Take a look. We're going to do some anatomy. So I want you to make a really angry face for me. Yeah, so this is the glabellar complex. It consists of two muscle groups. It's the corrugators on the sides and the processor on the center that comes out forward. This is the depressor muscle of the upper third of the face. It pulls the face down. So now if you raise your forehead for me, do that. Pull up really hard. Yeah. So some people's frontalis gives them very multiple striations, like really tiny fine lines. Yeah, so we can see that this is the frontalis. It gives us those really deep striations. His muscle's very bulky there. Some people's is very thin and flat and gives us very small, tiny lines. He just gives us a few lines that are very firm and hard. And so this is the extent of the frontalis here. And then we treat all the way up to the hairline. Sometimes some people with shorter foreheads, we have to treat into the hairline because we don't want to get too close to the brows to drop them. All right, so scrunch up your nose for me. Yeah, so this is the nasalis. You can see it's actually pretty active. You can tell that he likes to use a lot more of his glabellar nasalis here, and so we're going to make sure we treat these muscles. The nasalis will tend to compensate for movement when we over-treat the glabella. So by pre-treating it, we don't have to worry about getting all these little bunny lines and also bulking up the side of the nose. Now relax, give me a big smile. Yeah, we love that smile. So actually, he really doesn't have too much movement over here in his ubiquitous oculi. But we are going to treat it and just kind of freshen it up a little bit. You can tell that, later on, he'll probably will still develop a little bit of crepiness under here. So I'm going to do a little bit of microtoxin here. That'll help relax the skin and give it more of a smooth effect. Raise your forehead for me. So we have a little bit of movement here out in that lateral temple. This was a lot lower. We just noticed that it's starting to recruit a little bit of movement here, so I want to make sure I'm treating it prophylactically so it doesn't bulk up on us as we're treating the frontalis.